Hi everyone, it's Deidre. Welcome back. So the last time we met, we had a little bit of career talk. And at the end, we touched a little bit upon why major in public health. And one of the reasons that I gave was because of so many options. So today, we are going to pull on that a little bit more and talk about what some of those options are. So right now, public health is really practical because of what's going on and what's happening. As I said before, we need you. So it would be a good move for anyone who's a current student or recent grad or even someone who's contemplating a career change. And that's because even right now, there's so many people who are already in the field of public health that come from various trainings and backgrounds. And as I said before, public health is so complex and so diverse, there is room to kind of find your niche. A key fact about public health is that it's very service oriented, as in really centered around providing services or information to the public. And those positions within the field can range all the way from your C-suite executives to the health educator who's maybe just starting out and fresh from school. Like most professional fields, there's different sectors that you can choose, right? So there's your government sector, which could include, like when we're talking about public health, the department on the federal level, it's the Department of Health and Human Services, and then all the agencies therein. So there's like the CDC, FDA, etc. It could also mean local, state, or county health departments. It could also mean public schools, and that's all considered government at different levels, right? Then there's your private, and private can have a range of nonprofit, for-profit, foundations, hospitals, think tanks, colleges and universities that are private. And then there's maybe international, which can be like a combination of all of the above, but just on the international scale. So that may also require, for those of you who are, really excited about living in different countries and moving, and there's other things about citizenship and work visas that are involved depending on the job, but international health is like that. And a way that you can also do work in international health is even kind of going back up, right, to those government programs like USAID and programs that are really looking at health and help with other countries and developing nations. There's also private, whether they be nonprofit companies that also do international health. So that's also a field or a sector that one can get into when it comes to public health. So some of the field concentrations that are in public health are like epidemiology, biostatistics, sometimes really combined as EPIBio. There is social and behavioral or community health, maternal and child health, health law and policy, health management. There is global public health, which is a little newer than some of the other ones, but it's really interesting as well. And so I'm gonna go through some of those, and we'll talk about what the actual field is, like so tiny description on what it is, some job examples, maybe the issues that they cover, and maybe we'll talk also about the crucial skills that you can develop or things that you should be interested in before you go into those fields. Let's start with epidemiology. It's the study of disease patterns and trends within a given population or community so that then we can determine or even predict certain courses of actions that we should take when it comes to a particular illness. I think we all can see an example of how epidemiology can help, right? So some specific jobs that are within that field of epidemiology are public health analysts. You could be a researcher, someone who is really into like monitoring and evaluation. So like some crucial skills that you would need for epidemiology is really liking to be analytical, analyzing data. Because it is a lot of data. You have to really research and be into the numbers and sometimes math. And that even moves us into biostatistics. And this is why sometimes you'll see with a lot of public health schools, EPIBio, sometimes they separate them, but sometimes they're together. And biostatistics is actually describing, analyzing, and interpreting that health data so that, decisions can be made on both the health and medical sciences. And so some jobs that are really critical to biostatistics. You can be a biostatistician, much like you can just be an epidemiologist. And one that's really important is like health informatics, right? As technology and healthcare is evolving more and more every day, health informatics is really, really important, especially even in the way that we look at our health systems and medical records, and using medical records to determine how, patients may respond to certain medications, how populations are responding to vaccines or things like that. So all of that is biostatistics. And again, like some skills or things that you want to be interested in is numbers, math, and analyzing data. So the EpiBio, they are not the same thing, but they're similar fields. So another one is maternal and child health. And that really is the study of women's health and children's health, preventing women and infant mortality when it comes to birth rates. Some specific jobs that are within that realm are program directors, and that can be a program director of a number of different types of maternal and child health programs, a health educator, right? So like it can be in that community center helping to educate the local residents about mortality rates and how they can keep themselves healthy. Some issues covered in the realm of maternal and child health: nutrition, right? That's a big one. How do we focus on the things that we eat and take into our bodies to remain healthy, especially when it comes to that relationship and that sharing between mother and child. There's health equity, right? And that's going to be one that transcends across many of the different fields. And health equity is definitely in there, especially when we know lately what has been on the stage when it comes to women's health is the alarming rate of death for Black mothers in comparison to white women who give birth. So definitely health equity and women's health are things that you can focus on in maternal and child health. And some skill areas that you might want to be interested in is really like health communications, right? Because that is about intervention and educating communities. So communications, health education, health promotion, research is in there as well. Much like health equity, research is a skill or even a job that will transcend many other fields. So then there's health law and policy. So that one is really interesting because health law in and of itself can just be something that sits in the legal field. When we add it to public health and policy, it really is focusing on how laws and legislation affect the public health system and how we interact, how we promote interventions, how we focus on communications, and how we actually do things, how those systems are shifted for a given population, right? So some ideas of things that you can do in public health policies: work for a public health law center. You can be a lawyer, maybe general counsel for a public health organization. You could even teach. So those of you who are further along in your career and interested in teaching, you can work at the college and university, right? So that's an idea of the different sectors. So like the private sector at a private institution of higher learning. Some skills that you would want to have is also research. That field of law and like understanding policy and regulatory affairs is really, really involved. And especially in public health, when it comes to policy, you need people who are able to decipher and dissect, right? Not everyone can speak legalese, but so it is a skill that is learned, and once you learn it and learn how to navigate those terms and terminology and how those things work, it's really beneficial. One really great example of why health law and policy is important is like when we think of the Affordable Care Act, right? So that's a whole law that was passed that really affected people. I remember when I was going through to get my master's, to get my MPH, one of the biggest issues at that time was the lack of health insurance. And it still is an issue now, but what we didn't have back then was the Affordable Care Act. And so we now have a mechanism for people who are less fortunate to have a mechanism for health care. So that is an example of how health law and policy falls into the public health realm. So then we have social and behavioral health sciences, right? Or you could even call it like community health. And that is really focusing on those interventions in the community, right? Looking at social determinants of health and risk factors that affect a given population or community. And different issues covered in that field is like tobacco control. So that's kind of where I sit in tobacco control. Tobacco control can also kind of move into that policy space depending on what you do, because I also do advocacy. So I sit kind of in this realm between health policy and social and behavioral sciences. So a lot of these things, like I said, public health is really complex. So they kind of, each field kind of touches on one another, and it's helpful to know a little bit about each field because you actually will have to use some of these skills depending on what it is that you do. So tobacco control is an example of an issue covered in social and behavioral health. Nutrition, just like in maternal and child health, looking at, what we have around us and how we're eating food. Obesity, diabetes, like these are all things that are covered by social and behavioral health. And some skills that you would want to have or things that you would want to be interested in are, again, the research, health promotions, because it focuses on the interventions. So then we have environmental health. And so this one is really interesting because environmental health is not just looking at, I think a lot of times when we think environment, we think like the outdoors and what's around us, but sometimes we have to think about the built environment, right? And so that's like our urban areas and the cities and what's around us. And so environmental health focuses on the relationships that people have with their surrounding environments. And again, whether that be like, our actual natural environments or that built environments in like those urban settings. And some issues covered or job examples are people like toxicologists, right? And an interest for someone who wants to be a toxicologist would be interested in like research and also like maybe working in the lab. There's chemistry involved. Also with environmental health, nutrition is a big deal. So when we think about things like food deserts, right? Or even food swamps. So like food deserts with being the concept that there are not a lot of grocery stores in urban areas or certain areas where people can get healthy foods, or a food swamp. The converse of that, a food swamp being an area that is like overburdened with unhealthy foods. So that's an example of how we look at our built environment. Another example of that is what we call like tobacco tunnels, like a lot of urban areas that have high rates of tobacco use or actual tobacco retail outlets. Young children will walk down a commercial strip and pass by, they can hit a corner and there's a tobacco retail outlet on every corner. And so it's just like walking through a tunnel and nothing but ads. And so that's like your built environment and looking at that from that angle, right? And so some things that you would want to be interested in or some skills that you want to build or things that you would be able to build is like I said, that research, lab work and chemistry, actually going out and doing surveys. So like, field work surveys and the like. So finally, we have global public health. And global public health can really be described as a combination of all of the above, except there's one crucial fact in that it transcends sovereign borders, right? We go beyond country borders and really look at like worldwide health. How are people being affected on a worldwide scale and how that interaction affects one another. And again, we can even look at what we're witnessing now with COVID-19 and the pandemic. That's an example of global health because we have the World Health Organization who we're all looking to kind of figure out how do we do this? Where are certain countries when it comes to the prevalence of contraction rates or disease rates? How many deaths have we had? So that's an example of global public health. Another example is that is like when we have agencies, whether they be government agencies or private agencies that have international programs that work in developing nations when we're looking at running water, women and girls' access to feminine hygiene products. So these are examples of global public health. And so things that you want to some jobs that would be interesting to get into are like maybe health economics, and even the health economist can also be something that can transcend to health law. There's like looking at infectious diseases, right? Or even like just the health scientists. And some things that you would want to be interested in: research, that health communications and promotions, because again, we're talking about transcending borders. And so when we do that, there definitely has to be a mode of communication. So with all of those things listed, you know, there's definitely some jobs that are, as we've seen, like jobs and interests that go in between some of those things. So there's like your health scientist, your public health analyst, and that's like a very broad position that could even incorporate things that have to do with research and evaluation and monitoring, or even some portions of EPIBio. There is a program director, health director. So these are very administrative positions, right? And those can be coordinator, director. They can be in any kind of level of public health depending on the structure and hierarchy of a given organization. When we think about global public health and health policy, there are positions, and like I said, remember, we can even go all the way up to the C-suite. There's the CEO of a public health organization, the COO of a public health organization. There is the health commissioner, things like the minister of health, where in those positions, that is usually going to be someone who carries that MD, MPH, or maybe even just an MD. Usually that person is a clinician. Clinicians are examples of jobs in public health that can transcend some of those different field areas, as well as like health consulting, communications director. So there are a lot of varied positions that you can hold within the field. And as I said before, you know, because it's so varied, you don't necessarily need to have a public health degree to do some of these. So this is really just talking about the things that you can do with a public health degree, or even I would go so far as to say the things that you can do if you are interested in transitioning to public health, because there are a lot of different jobs within the fields of public health that where transferable skills would definitely work. So I hope this was helpful for all of you. We'll see you next time when we get into more information with Deidre. So as always, please remember to like, share, and subscribe. See you in the forward.